Well, good afternoon, everyone. We're so delighted that you're able to join us. This is a presentation I personally have been looking forward to for quite some time, so I am delighted to bring this to you. Let me do some introductions and housekeeping first, and then we'll turn to the presentation. My name is Alison Sachs. I'm Director of Community Outreach and Cancer Support Services at Eisenhower's Lucy Curci Cancer Center. I am also a certified oncology social worker, and I wear that hat very respectfully in all that we do. So let me tell you a little bit about what you're going to hear today and how we're going to move forward. The first is, if you have any questions, we want you to enter them in the chat. You'll see your chat. Most of you will be at the bottom of your screen. We will get to them towards the end of the presentation. We also want you to know that we'll mute all of you, so you don't have to worry. You won't be disturbing anyone as you're talking. Marcia, I see your hands over your face. Don't you worry about that. We can't hear you, so don't worry. Okay? So this is a presentation, a very important presentation on women's sexual health after cancer treatment, an intimate conversation, one that unfortunately we find way too often patients are not having with their treatment team, their physicians, even their friends and their significant others. So we're really delighted that you could all join us today. Let me tell you a little bit about our speakers, our presenters. Shay Moraga. Hi, Shay.
Hello.
Hello. Shay is a mom. She's an entrepreneur. She's a community leader, a yoga instructor, a volunteer. She's a cancer thriver, and she's an advocate. And there is actually so much more to her. But on February 11th in 2016, her world changed drastically. Shay was diagnosed with an extremely aggressive form of breast cancer, stage 3 triple negative breast cancer. And because of that experience, she set her sights on a new goal in her life, and that was becoming a cancer survivor. When Shay was done with treatments, she realized she had a lot more healing to do. And at the end of 2018, she founded what started as a local and now is a national, and my guess is soon to be international nonprofit called Shay's Warriors Life After Cancer. This group gives back to women and their families through the mind-body connection. What more would you expect from a yoga instructor? And wellness, reminding cancer thrivers, Shay likes that word, so do I, cancer thrivers, that they are never alone. They have a community support group. They host online virtual educational and emotional support groups. They gather for coffee and connection, and they move to heal and they move to communicate. We are delighted at Eisenhower Lucy Curci Cancer Center to partner with the local Shay's Warriors team. Joining Shay is Dr. Sage Bolte. Dr. Bolte serves as the Chief Philanthropy Officer and President of the Inova Health Foundation on the East Coast. She joined Inova quite a few years ago, initially as an oncology counselor. Then she was the Executive Director of Life After Cancer and Patient Experience for the Inova Shar Cancer Institute. She is known nationally for her work in sexual health and cancer and is a respected leader in the fields of oncology social work, one of my friends and one of my mentors. It's so nice to see her here. Dr. Bolte has written or contributed to several peer-reviewed articles and books, and she wrote 3 chapters in the Oxford textbook of the Handbook of Oncology Social Work. Well, we couldn't ask for 2 more incredible experts to join us for this intimate conversation, and I will turn it over to both of you now, and thank you for being here.
Wonderful. Thank you so much. And it's a privilege to share the stage with Shay. You know, our hope in this conversation is that it is just that, a conversation. I recognize that this is a topic that sometimes can hold us back from asking questions to our providers or even in a support group setting. And I just want to provide permission today that this is a place that I hope, whether it's in the chat anonymously, whether it's out in your groups afterwards, but that you find permission here to ask questions that are going to support you in your full whole self. And a huge part of that full whole self is your sexual self. And everybody comes to cancer and the cancer treatment and the recovery from cancer or ongoing treatment with their own experiences related to their sexual body. And Shay and I were talking and getting to know each other earlier about, you don't always even have a lens of how your sexual body can change until it's forced upon you. And the awareness of that, especially related to cancer and cancer treatments, can be pretty startling. So I thought it might be helpful if I just give a very brief 5 to 7 minute overview of the common side effects and impacts that cancer and treatment have on the sexual self. And then we'll get into question and answers and get into all the nitty and gritty you want to talk about. My door is open. I am very willing to go anywhere with you, so please don't hold back. There is no wrong question. I want to start with a high level just overview. I use this word sexual self very intentionally, because we have our ideal selves, right? The thing that cognitive model of how we view ourselves as a woman, as a man, as a person, as a mother, as a partner, as an advocate, as an employee. There are lots of lenses that we see ourself through. Another one of those parts of ourself is our sexual self. And our sexual self is often influenced, grown, developed over time through many things. Our cultural experiences or our cultural background, our faith and religious backgrounds, our family, our parents' willingness to talk about our sexual bodies or watching intimate relationships, what we learn or don't learn in school, and the relationship we have with our sexual body, which can be influenced by positive experiences where we're encouraged and nurtured and really encouraged to understand our bodies and explore them, to more traumatic where maybe we've been sexually violated. And through that, I think it's really important for anyone that is watching this recorded. Sometimes the topic of sexuality, sexual health can actually be triggering, especially, again, if you've experienced any kind of sexual trauma. So I just want to name that and remind people to take care of yourselves in this process. If it feels flooding or overwhelming, pause it, walk away, or maybe reach out to Allie and ask for support to get some support to talk through whatever got triggered for you. So with that, again, when we think about our sexual selves, we come into cancer, and if we're an adult, we've had probably some sexual experiences. We've had the ability to kind of maybe walk through some changes in our body as we've gotten older. Maybe we've navigated some uncomfortable moments with a partner or partners. And cancer comes and certainly interrupts that, no matter what our age. The common experiences of cancer and its treatments for women premenopausal is that it often, again, forces a medically induced menopause or acute menopause, where your body is suddenly and swiftly thrown into medically induced menopause. Your ovaries shut down, and what that creates often is many menopause symptoms: hot flashes, vaginal dryness, potentially vulvar or vaginal pain with intercourse, masturbation, or utilization of a toy, or gynecological exams. It could cause the thinning of skin, and that's true for the vagina. It's also true on the face. You might notice that the collagen has changed, the texture of your skin has changed. You might notice as well with menopause that your libido changes. And libido can be influenced by hormones, but it can also be influenced by many other things. And for those of us who have had children, kids interrupt our libido because we have to be on, or our sleep patterns are interrupted, or we're worried they're around the corner, or we have to plan everything and lock the door, right? So everything feels more planned. That can influence our libido. Gaining weight, losing weight, our hair falling out, our hair getting thin, our hair changing. Lots of things physically can also influence our libido. So can stressors, depression, anxiety, medications that we prescribe for depression and anxiety often further exacerbate libido, whether it is decreasing a libido or making it harder to have an orgasm. The medications we prescribed often for, again, depression and anxiety can further exacerbate that. So the most common complaints of women in general, whether premenopausal and thrust into a medically induced menopause, or peri or postmenopausal during treatment, again, are a decrease in libido, interest in, and again, influenced by external stressors, the treatment itself, and then when we think about even just some of the side effects, dry mouth, right? Have any of you been licked by a cat, and that just tongue dryness that a lot of people have when they're going through chemotherapy can be, for some, self-conscious. It might also just be uncomfortable. Mouth sores that can be caused by treatment. Neuropathy. Some of these side effects that we talk about that are so common from a chemotherapy treatment, or a systemic treatment, that we often don't connect to sexual health or sexual function. But if neuropathy is happening, your hands and feet are tingly, that's really distracting. And in many ways, it's so distracting that it does influence pleasure, or your ability to be present in pleasure, or again, that interest in sex if you're in pain. Pain is another one that influences libido and also influences, our ability to be sexually active. If we have pain from radiation, pain from surgery, maybe again, neuropathic pain or metastatic pain, that can influence our desire, interest, or ability to be sexually intimate. And I want to pause really quick and remind people, when I'm using the word sexually intimate, I'm not necessarily talking about intercourse. There are lots of ways to be sexually intimate without intercourse, and whether that's intercourse you have a partner of the same sex, whether that's intercourse and you have a partner of the opposite sex, whether that's oral sex, anal sex. There are lots of ways to be sexually intimate, including just laying naked together and being together. So sexual intimacy can be influenced in all of those ways, not just about intercourse. If you're tired, fatigued, feeling pain, if you're just not in the mood, if you feel like your partner is less understanding of you, if you feel like your friends are less understanding of your experience, it can create distance and emotional distance, which also influences libido, interest, and again, intimacy and connectivity. In addition to the menopausal symptoms that I mentioned, the common complaint for women is vaginal discomfort and dryness. So oftentimes, women find that whether it's a gynecological exam, whether it's intercourse with a toy or a penis or a hand, that there can be vaginal discomfort, and you might notice there's less lubrication, which doesn't create good friction. You might notice that there's actual pain upon insertion or inside the vagina. And those are common side effects, ones that we can address. And I'm going to speak really briefly, and then I know Shay will have a lot of questions about them. But you can use moisturizers, which are intravaginal moisturizers. It's kind of like lotion for the skin. An example of that would be a product like Replens, where you insert into the vagina, you let it sit. These are not meant to be used for intercourse or sexual play, but they're really meant, again, for moisturizing that vagina. Lubricants are for the vulva, but they can go in the vagina as well, and are to be used for masturbation, to be put on a sex toy, or a penis or a hand if you're using either of those. And that, again, just allows for less discomfort upon insertion and more comfort for both partners or for yourself. And lubrications would be used anytime you were going to be sexually active. There are other ways, and we'll talk about this maybe down the road, that you can also treat vaginal dryness and vaginal discomfort. And one of the things we'll talk about is also just your vaginal health. Shay and I can get into the details of what I mean by vagina gym, but I have some prescriptives on what I mean about that. But before we get into that, I also just want to acknowledge one thing before we get into Q&A. As I said before, this conversation can be triggering and bring up a lot of uncertainty or discomfort. We would be remiss to not continue this conversation without recognizing that one of the biggest factors of a cancer diagnosis is just the experience of grief. And that doesn't mean long-term grief or forever grief, but the majority of people, when told they have cancer, have a moment of loss. There may be so many gains out of that loss, But there also is the recognition that is often needed to be honored around what was will probably never be again. That doesn't mean it can't be incredible in the future, but it will look different. And that is the same with our sexual self. We will not look the same, whether that's physically because of scars, emotionally because of the changes this may be made. Maybe we're more appreciative of things. Maybe we're more cynical of things. Maybe we recognized friendships that weren't really solid or friendships that were really solid. But all of that changes. And there's loss. Again, there can be gain, but without the recognition of loss and grieving what was while embracing and being hopeful about what can be, I think we would not honor ourselves and our bodies without kind of, again, taking a moment to recognize the changes, recognize the losses, as well as giving permission to our partner or partners to also experience loss. If your partner had pleasure in, for example, your breasts, and your breasts had to be augmented due to breast cancer, they may have loss, and that doesn't make them a bad human or an unsupportive person. And it also doesn't mean that that loss is permanent. It's just a recognition of change. And that doesn't mean they can't embrace the new breasts or lack of breasts and find other spots on your body that they fully embrace, love, and find sexy. But again, loss is part of what cancer brings into our life. And then what we do with that, the decisions we make, the help we ask for, the questions we ask, the tools and resources we use can empower us to move through and redefine what we want, including what we want in our sexual self. So Shay, I know that's a high level overview and a lot to bring up. Is there anything else that I didn't cover in just that brief overview that might be helpful before we get into some of the nitty gritty and more details?
I think you are right on point with everything that we basically have to ask you and talk about today. So thank you.
Okay, great. So would it be helpful for me to go ahead and talk a little bit about when we talked about vaginal health and just some of the ways that we can improve our vaginal health? Would that be helpful, Shay?
Yes, absolutely.
Okay. So as a reminder, right, the outer part of our vagina is the vulva, right? We have the clitoris and the vulva before you enter into the vagina. And both can be influenced by cancer and its treatments, and whether that was through a pelvic cancer, whether that's gynecological cancer, vulvar cancer, colon cancer, or if it's from the chemotherapy or treatments that were exacerbated through menopause, that vaginal area can be influenced. And oftentimes people experience what we call vaginal stenosis, which is the narrowing of the vaginal canal. The narrowing of the vaginal canal is not much different than if you think about when you're going through treatment and you haven't been to the gym or you haven't lifted weights because you just haven't had the energy to do so, and your muscle's getting a little flabby, it's getting a little weak, things are looking a little more atrophied. The vagina is a muscle as well. And so if we are not keeping that muscle strong, it is more likely to become atrophied, including when we induce or exacerbate menopause symptoms. It can become weaker, less elastic, and because hormones help with elasticity and collagen, it can get weaker. So a few things to keep in mind as you think about whether you are sexually active or not. A healthy pelvic floor is really important for many things. One, nobody really likes the experience of when they sneeze or cough peeing their pants. So we like to keep a strong pelvic floor. And two, when you go to a gynecological exam, having no pain with that exam is really important for so many reasons, for your own benefit, for your own peace of mind, and so that you have comfort and you're willing to do it again. And three, if you ever should choose to be sexually active, we want that to be a positive experience for you. So dilator therapy is very similar. They look very similar to tampons. In fact, I brought a highlighter to show the difference. So you can see I have a pen and a highlighter, and they are different widths. Dilators are very similar. They come in very small widths, the size of my pinky, to about the size I don't know what that is, very small apricot, something small. That in the utilization of them, you start with something small, you insert into the vagina, and you practice what we call Kegel or Kegel exercises, where you squeeze that pelvic floor muscle. Now, this is that muscle that you use when you want to stop urination, when you're worried you might pee your pants. You squeeze that pelvic floor muscle. In fact, you can all do it while we're sitting on the Zoom and no one will know, right? You can squeeze. It's like squeezing your butt cheeks together and pulling down on your pelvic floor. That exercise is so important. Even that alone, even if you don't use dilators, doing that exercise of pulling in and tightening that muscle, you can do that at stoplights. You can do it while you're watching your favorite soap or TV show. But if you can do that every day, it's going to continue to help strengthen that vagina and that muscle, that pelvic floor. If penetrative intercourse or a gynecological exam is uncomfortable, using dilators will help the vagina again strengthen. And the way that it works is you insert the dilator into the vagina and you practice those Kegel exercises around that dilator. So it's almost like biofeedback. You can feel yourself squeezing, you hold for 3 to 5 seconds, you release. You're going to do that for 10 to 15 minutes a day. Is it inconvenient? Yeah. It's annoying. Will it help? Absolutely, it 100% will. You can get dilator therapy from vaginismus.com. They have a really great kit. It's $45. They're soft and pliable. The kinds that our radiation department give or gynecologist's office often give, although I love my radiation oncologist and my gynecologist, the ones they give are very hard and heavy and quite often can be scary for some women just because of how medical they are. So finding something that's a little softer, they're easy to clean, you can lay on your bed again and watch TV. Some women will do it while sitting in the bath or the shower. Practicing that and moving up to about the medium size will allow you to, again, strengthen that pelvic floor and have comfortable intercourse, should that be your goal, or a comfortable palpable exam by a gynecologist. There are also tools, one that is intervaginal radiotherapy that is like abrasion, microdermabrasion for your face. So it is a laser that's inserted into the vagina for 3 to 5 minutes. It's done by either a gynecologist or a plastic surgeon. One of the devices is called the Mona Lisa. Again, it's intravaginal. So they insert into the vagina, and that radiotherapy allows for collagen to be rebuilt inside the vagina. Now, of note, for women who cannot take estrogen receptive medication or hormone replacement, it is a good tool because it allows for collagen rebuilding without having to take any kind of hormone. I fully self-disclose on this. I had some significant pelvic pain and problem issues post 2 of my C-sections and was having a lot of challenges. And the gynecologist who does some sex work, sexual pain work with me in tandem, recommended I try the Mona Lisa laser treatment, and I found it very helpful for myself. Again, it's I said radiotherapy, but it's not radiation, it's laser treatment. Sorry. So that is a tool as well. And then again, really thinking through the best ways to keep a strong vagina are through stretching, and that's using dilators, strengthening with Kegels, and moisturizing, and that's an internal moisturizer. So you can use something like Replens. Honestly, a lot of women find supplies you can find on the shelf at the grocery store work really well too, such as coconut oil. And you can actually take coconut oil and freeze it into ice cubes. And although it seems cold and cruel, it works really well. You can insert a cube before you go to bed, and it will, again, provide moisture intravaginally. It's not necessarily meant to be used for lubrication for intercourse, although you can apply coconut oil to a penis or a finger if you so should choose. The other thing to be aware of related to moisturizers is if you are really vaginally dry, take a look and make sure they are paraben and glycerin free, as those two things can often be very irritating to the skin. So finding a organic Good Clean Love is a good product. There are many other products out there that can be good and, again, organic in nature. So that's vaginal health. Shay, any questions that I didn't answer related to that?
I think that was great. No, perfect.
Okay. The other thing I hear from a lot of women is just decreased sensitivity. And whether that's clitoral sensitivity or vaginal sensitivity, and some of that's because if you've had radiation to the pelvic area, your blood flow may be influenced, so your nerve endings may have changed. It's all worth, again, going to a gynecologist that specializes in aging or a pelvic floor therapist who can assess you. And to that, there are pelvic floor therapists who are physical therapists that will assess and address any pelvic pain or challenges you have. They're amazing. They are angels. They can do pelvic floor release. If you're having too much tightness, they can do biofeedback to show you how to relax and tighten the pelvic floor if you've lost kind of that head-body connection, and are a great resource, again, for helping you learn how to strengthen and improve the health of the vagina. For clitoral sensation,
I will jump in there. This is Alison,
please,
in letting everyone know locally that we have such a program at Eisenhower in our physical therapy department. So that's a wonderful no.
So important. And it's a great investment that organizations like Eisenhower make. So thank you, Allie. And I think, the other piece of that, in addition to pelvic floor and sensitivity, your clitoral sensitivity may change. And that happens as we age in general. It may not be the same. It may be that we have to get a little bit more creative or find new ways to stimulate it. Warming creams can be helpful. It just adds a little zip to that area, helps with blood flow. Anytime we can increase blood flow to the vulva, to the clitoris, it will allow us to be more successful. So stimulating the clitoris before masturbation or sexual play can be really important. Warming, again, usually I say warming creams. Warming liquids like the His and Hers, they kind of have a reputation for a high for a second and a real fast low, and they're known to be a little bit sticky and not necessarily last very long. So again, clitoral stimulation. The other thing a lot of people say is just sensitivity in my body has changed. If your nipple sensation has changed because of whether that's surgery treatment or hormone suppression, the beautiful thing about our bodies is how incredible they are at adapting. And I'm sure many of you have seen this in different ways, but our body is our skin is our largest sex organ, and we have a lot of it. And cancer cannot affect all of it, right? It can affect portions of it, but it very rarely affects all of it. And our most important sex organ is our mind. And again, cancer can affect that. Certainly, we can get chemo fog and chemo brain, but that doesn't necessarily influence our sexual ability to fantasize or to think about desire. One of the greatest gifts we can give ourselves if we want desire is to want desire, right? Because if we want desire, then we actually don't not have desire. We have desire, we just don't feel the desire. But if we can think about desire and we want desire, we have desire. Sometimes I think as women, we put this in our head that if I'm not physically turned on when my partner touches me or when I look at someone I'm attracted to, that somehow I don't have desire. And we really have to flip that script, that desire is not about a body response saying, oh, I'm turned on. Desire is absolutely 100% in our mind. And really reframing how we think about desire will free us and give us permission to think about all the possibilities, right? If I fantasize about being physically intimate, or I fantasize about a time where I felt really good or sexy, as I do that, my mind is starting to create a different storyline, different pathways, neural pathways to say, oh, I can be sexual. Oh, I am feeling, oh, look at that. I'm thinking it, now I'm feeling it. So again, giving ourselves the permission to flip that script of libido starts here, desire starts here, not necessarily in the body, especially when we're no longer in our 20s, right? So really thinking that through and putting things in your mind, putting things in your day that help enhance your desire, wearing something sexy or strong that you feel confident in, putting on a perfume that's very appeasing to you, having aromas, a candle, a glass of wine, something else that allows you to, again, have in your mind something that can influence the feeling of sexy, turned on, feeling more desired. And I know, Shay, we also want to talk about relationships and changes in those or challenges in those. Are there other things related to our body that were brought forward?
Yes. One question was, what are the steps that you would suggest to communicating with your partner about intimacy, getting intimate, or not feeling so intimate?
Great question. And I do have kind of a script, but I want to just preface that by saying everybody is unique and every relationship is unique. So you need to know, what works and doesn't work within your relationship. And if you try this and it fails miserably, my next step would be find a professional who can help you work through it together. So typically what I say is if you're in a healthy relationship and communication has been something that you've been successful at, getting through a cancer diagnosis is a hard thing. Having kids and raising kids together, hard thing. And we don't always agree. Having a fight and figuring out how to make up, not easy. And it doesn't always work. So some of this in having these conversations, we need to remind ourselves that it doesn't have to be perfect and that we might kind of clunk through it. And we might say something that evokes emotion, and that's okay. So what I would advise is thinking of 4 words: stating a fact, stating your belief, stating your feeling, and then stating an action. So I can give you a very simple example. And you can use this with your friends too, with your intimate relationships that are non-sexual. Ever since my cancer diagnosis, you've stopped kissing me when you come home from work. I think it's because you're not attracted to me. And it makes me sad that cancer has changed that aspect of our relationship. What I need from you is to show that you are interested and eager to be connected with me, even if our sex life has changed. So I would love if you would kiss me when you come home, right? And that's giving them an action, because oftentimes what I find in couples is we do a lot of you haven't, you don't, I'm sad. And then we just kind of leave it to them to figure out. So making sure that we give them something to do, how they can show action, is really important. The other key of that, though, is when they do it. So let's say your partner comes home and does come and kiss you and does that a few days in a row. You don't have permission to say you're only doing that because I asked you to, right? You say, thank you for doing what I asked. Thank you for hearing me. Another way of talking about intimacy is also just acknowledging, just really simply, you know what, I know cancer has affected a lot of things in our life. It's affected our time together. It's affected the time I'm home. It's affected my energy. It's affected your needing to take on more or needing to take on more. And I also know it's affected our sexual intimacy. And I am guessing that may be a little challenging for you. And I'd like to just talk about it and open the door for it. You also can be really honest and say, cancer really has changed my sexual needs, and I don't know what that means for me, but I'd really like to have a conversation with you about it, or I'd like to go talk to someone about it to see if we can find some common ground. Some partners may have desires that are unrealistic, and talking to a professional to really sort through what is realistic, what can be accommodated, where the two of you land on what is possible can be helpful. And oftentimes, if there is a discrepancy in desire, I will talk about what that partner can do on their own, or what within the marriage or partnership they have permission to do. For some, that means they may have an open relationship. For others, it means he or she can go masturbate. But making sure, again, when there's discrepancy, it's not blaming or pointing, that there is a mutual conversation and a mutual agreement on what can be done to address it, and or what individually can be done.
Great. We have another one too. What practical steps do you suggest one gains confidence with your partner and your own body image post-cancer? And I think that this person is asking, how can I gain confidence to look and feel sexy within my partner and to get intimate again?
Mm-hmm. Such an important question. And this is a hard one to answer in a group setting because everybody comes to the table with different experiences and impressions of themselves pre-cancer and post-cancer. So, first and foremost, just as I would with anything else, whether it was adjusting to a new job, addressing a challenge you're facing, always start with yourself first, because building that own internal confidence first will allow you to build it in with your partner as well. So some steps you can take to build your own confidence is one, just catching your thoughts. So I happen to be a cognitive behavioral therapist. I truly believe, and there's enough science to show it, that our thoughts can influence our feelings, which then influence our behaviors. So for example, if I wake up every morning and say, oh, I can't believe I still look like this, right? Or, oh, I can't look at that scar. The message that is sending to our body is something is broken, something is wrong. The feeling our body is going to have is probably sadness and anxiety. And the behavior we're going to demonstrate is withdrawal, hiding, retreating. When your partner comes to hug you, you may jump or push back, right? Or push their arms away or not want to, be touched. So starting with our thoughts is really important. Catching those negative thoughts and offering a different thought is the first thing we can do. And we can do that by simply putting sticky notes on our mirrors around our house of things that are just encouraging. Like, you will heal. You have the power within to heal. I would caution us to put things like you're a goddess or you're the most beautiful woman in the world, because those are hard things for any of us to believe. Now, God bless you if you can get there with your confidence, but in this day and age with the world we live in, that's a hard one to swallow. But we can find strength, right? You are strong. You are resilient. Your body will work with you to heal. You can feel sexy again. Those kinds of encouraging thoughts can go really far if you're putting them into your mind. If you have the I can't instead of I can, what do you think you're going to believe? So if we can put in our mind I can, it's really important. Additionally, as we think about just not just our thoughts, but also then some exercises we can do. There's a body image exercise where you go in front of the mirror, you go in like your best outfit, you have your makeup done, or if you don't ever wear makeup, just go how you typically would go out feeling confident. And you look in the mirror and you find 3 things about yourself that you could identify as beautiful, pretty, strong, something that has a positive connotation. And it might be your smile, right? Oftentimes, treatment doesn't change our smile. It might be the way your eyes light up when you smile. But finding 3 things that you feel confident in. And when you can do that regularly for a week with your clothes on, try it with something a little more revealing, like lingerie, or a bra and underwear, or a t-shirt and panties. And then find 3 things that you find on your body that you feel confident about or that you can embrace and love, right? Maybe it is a little bit of the weight you've gained that you're just embracing that because it kept you healthy and strong through treatment, that it was the thing that, again, helped sustain and grow you. Maybe it's the fact that you can look and see the color of your eyes hasn't changed, and that's reassuring and beautiful. Whatever that might be, then the next step is looking in the mirror and identifying 3 things or more on your body naked. And that isn't just at your face. So really looking at, I like the dimple on my shoulder, or I can see where my breast scar is fading and the strength of my spirit is screaming at me, right? You're finding those things on your body. With loving and accepting your body, it also comes with touching and knowing your body. And so that might be massaging the scar, and that might not be first looking at it. It might just be massaging it. You may not be ready to look at it. And then beginning to look at it slowly. It might be while you're in the shower, just again, touching your body and realizing, oh my gosh, the skin on my body is not all messed up, just parts of it are, right? That my neck still feels really tender. And really, again, getting to know feelings in your body that feel good can be helpful, because the next thing in helping build intimacy with your partner is certainly emotional intimacy for many is equally, if not more important, in order to have sexual intimacy or satisfying sexual intimacy. Not for everyone, but for many couples, that's important. So building that that intimacy, emotional intimacy, to the physical intimacy. And if you can feel confident in your body, you'll be able to guide your partner on what has changed or what has felt good or doesn't feel good. So for some couples, I'll give them a red and green crayon, and I'll tell them to draw a little stick figure. And red means no or not right now, and green means safe, go, this is okay. And it's also really helpful because what you find is there might be some red, but it's small red. It's not all over red. So there's a whole lot of skin that you can play with, and starting really slowly. Just with basic, even massaging one another, or sensate focus exercises where you're just feeling sensation and non-sexual sensation, just sensual sensation, to get yourselves comfortable and used to being sexually intimate again. Laying naked together. Begin with going to the basics of just kissing and not feeling this like need to have intercourse or need to have orgasm. Just get back into some of the basics of intimately connecting, and finding ways to navigate that as a couple can really vary. And that might mean intercourse in the way that you used to. It might not be. And what is really important is that when we are open and open-minded, we can find a lot of things that can be sexually satisfying within our partnership, that as long as we're willing to have a conversation and try new things, or identify where we're struggling, or say, ouch, that hurts, that doesn't feel good, but when you do this, it feels good, we're able again to really empower in our relationship a really healthy sexual relationship.
This concept, I'm going to jump in because this concept of communication it's just enormous. And we talk about this often in cancer, and you all know that, whether you're in a group or you're talking to a therapist, or it's vitally important, and to recognize what was happening prior to cancer. What were your communication skills like as a couple? And acknowledge that. Cancer is not going to fix it. Cancer hopefully won't make it worse, but start with what was it like before cancer, and then move forward from there. I think that's a huge issue around for all of us in any relationship, cancer involved or not. How do we communicate, and how do we talk, especially about something as important as being intimate with someone you love? It truly, truly is. Yeah. So that's huge. Sage, thank you for that. I want to turn this a little bit, and I'm not sure you can help us with this or not, and Shay, forgive me for jumping in, but this has been a continuous topic in our breast support group at Eisenhower at Lucy Curci Cancer Center, but also off topic, outside of group. I'm hearing quite a bit, and it's not that it's new, but it's a new dynamic and discussion, and it's about using the term flatty, about not having breast reconstruction, about leaving it be, and somewhat of a political movement in a way, and a little pressure. And we're starting to hear on both sides, women who explain, look, I decided I didn't want these breasts anymore. I had one breast cancer and one not. I wanted them off. And I didn't want reconstruction. I got a lot of pushback from my surgeons. And on the other part of that, we're starting to hear, I'm feeling really pressured by these women who are telling me, don't let them put foreign stuff in your body. Go. And so I thought you would talk a little bit with us, Sage, if you would, about that whole concept, and how women on either side of it can use good communication skills to talk about it.
Yeah, this is a little bit of a minefield, Allie. Thank you for throwing me in that one. And Shay, I welcome your thoughts on this too. In general, we have such an opportunity as a cancer community to come together and to not only come together, but to understand and respect differences, because we were all different before our cancer diagnosis, and having cancer doesn't make us the same. It just means we all had cancer. And I think really respecting individual choice, especially individual choice that is well informed, right? There are going to be women who absolutely make a choice and feel really good. They've never had a deep connection with their breasts. Their partner may or may not as well. And they're very comfortable saying, I really don't have a relationship with these, or I don't need these. I feel like I am myself with or without these. Good for them. That's amazing. Some women may choose to put tattoo on their chest and really embrace the beauty of being flat. Other women, they have a really meaningful relationship with their breasts, and not having breasts changes the way they view their body in such a way that they can't have that same kind of relationship. And that's not a judgment of they're weak or they're vain or they only see themselves as breasts. No. Some women have a really meaningful relationship with their breasts and enjoy the appearance of them on their bodies and feel empowered when they have it. It may be that they feel feminine. We can layer that up if we want and say society has made breasts feminine. We can do all that. But the reality is, it's where we are. And for some women, having breasts visually as well as sensually are really important for them to feel connected again to something that feels good to them, felt like what they had. And both, not or with, are both okay. What is most important is, are we walking into that decision with information, with our own sense of self and our own decision and clarity? And that doesn't mean our partner doesn't influence our decision. There's also nothing wrong with a partner influencing our decision, right? We're in a partnership and we make decisions together often. And to say to that woman who chooses to get breasts because she and her partner decided actually it's a really fun part of their sexual life and they'd like to keep it, we don't get permission to shame that just because they made that choice. And vice versa. If a couple decides, I just worked with a couple who said, I don't need reconstruction, and her male partner was like, yeah, you don't need reconstruction. There's a lot more on your body that I enjoy. Like, good for them. Go
Right.
you.
Right.
So I think, again, finding the ability to have, isn't it beautiful that we're even in a world where we can have these conversations and that women have choice? And that goes back again to, let's celebrate and embrace the fact that women have choice. And maybe they choose, I know women who choose to do some reconstruction from a lumpectomy, and other women who think, why would you do that? Choice. They have choice. And for every woman, I want to put it out there too, if your body had ever been violated as a child, to have a flat chest could actually be re-traumatizing. So I also want us to think about, not, instead of criticizing or shaming, let's get a little bit more loving and curious, and then supportive of people's decisions that they make. There's my landmine I just jumped into.
You did it very well, and I knew you would. Thank you so much. Is there a place, and again, forgive me for jumping in, I'm just learning so much and just so appreciative of the time. Is there a place, when we diagnose women with breast cancer in our breast center at our hospital, we give them we call it the Big Pink Book, Breast Cancer Handbook. When men are diagnosed with prostate cancer, we give them information from Zero Prostate and Prostate Research Foundation. Is there a place for women to go, Sage, for this information about sexual health, intimacy, healing?
Yeah, absolutely. There are a few books. So Ann Katz, who's a nurse out of Canada, has written Woman, Cancer, Sex, and it's got a lot of great information in there. There is a book written by one of my mentors, Sally Foley, with two of her colleagues, Sally Cope and Dennis Segru, that calls Sex Matters for Women. And this is kind of what I think is like the sexual health Bible for women. It is a great resource. Some of it may not apply to you at all, and some of it may be completely relevant. There's a section on aging and sexual health. There's a section on illness and sexual health. There's a section on body confidence and self-esteem. So having that information, again, because it's not just cancer, it's just as women, we're not well educated on aging and sexual health, on resources in sexual health. The other resource that's out there is to find a sex therapist, a certified sex therapist. And again, a lot of people can call themselves sex therapists. One of the things you want to look for is a certified sex therapist. So that is AASECT, American Association of Sex Educators, Counselors, and Therapists. asect.org, you can find yourself a certified sex therapist and or potentially a gynecologist who is a sex counselor and specializes in women's health, or a physical therapist or a spiritual person like a chaplain who specializes in sexual health and is considered a sex counselor. So those would be the resources I would start with.
Thank you. That's very helpful. Thank you. Well,
Shay, can I put Shay on the spot for a minute? Shay,
yeah.
can I put you on the spot?
All right.
So great. So when you think about what was helpful during your journey and thinking about, finding your sexual body, which is an ever-changing experience, finding confidence in that, as well as, what you wish you would have known. What do you wish you would have known both before and after your cancer treatment that would have either helped you move into the healing process or your sexual body sooner? And then, what has that journey been like for you personally?
Wow, that is
I know it's loaded.
It is a loaded question. Well, first of all, I think that what I wish I was prepared for was the actual trauma. And I say trauma of feeling the violations of cancer going into my breast. Like I couldn't control it at all. I think knowing the uncertainties, the unknown, whether I would have to have a mastectomy or a lumpectomy. And then after it was done, just the scarring, which brought me back to the trauma. No one really talked to me about that. No one really said, when you look in the mirror, that will be there, that scar, or your nipple is no longer there. I wasn't prepared for that mentally. Being a young woman, strong, I was healthy. I thought I was healthy. I was not prepared for any of that. And I wasn't prepared to not want to touch my body anymore. So for a couple of years, even that scarring, I literally would not look at that breast. So I think that's the first part of that question.
And how did you move through that then? What were the things that worked with you to and I'm sure that it's still a journey for you. There is no kind of beginning, middle, and end. I feel like it's a constant, especially just as women, as we change, our bodies change, relationships change. It's a constant. So what has been helpful to you or worked for you in navigating that?
I think really going back to the principles of when I was actually going through my cancer journey, going back to my yoga principles, my meditation, my understanding, my letting go of things I can't control, and trying to do visualizations of I'm still this whole person. I'm still the same person, but it's just a little different. My body, and reframing a lot of it, I'm strong. My body really kept me healthy. I made it through cancer. So reframing all of that, at the end of the day, who looks at my breasts? Thinking about that, they're not on show unless I'm in front of the doctor or, my partner or myself. So really reframing keeps me going. And work. It is daily work. And sometimes even 5 years later, it still hits me.
Yeah. I think that's so important because, again, whether we use the word trauma, whether we use the word loss, whether we use the word change, so many people use different words, but all of it was out of our control. Other than some of the decisions we made during the treatment, many of it was out of our control. And I've heard from many women that it took a long time to look at their scars, and whether that was a breast scar, an abdomen scar, a port scar, even that, and some women I've seen, I saw a woman recently who had tattooed over her scar, "You are strong," or "You are beautiful." And just thinking that she's putting that visualization, that immediate reframe in her mind as she looks in the mirror. The other thing, Shay, you said was, who sees my breasts? And you are right? You're not, to my knowledge, you're not out displaying your breasts to everyone. But I also think that brings up a really important point that I say to couples. If there is some body image concerns or discomfort, you do not have to be totally naked to be sexually intimate. It's amazing. Like, we can be sexually intimate and have things on our body. So whether that's a really sexy cami or a lacy bra or pasties, I don't know. There's lots of ways to be still feel sexual without being naked if there are parts of your body that you feel for a while just that you need to cover. There is no shame in that. I think sometimes we feel like we have to be willing to show it all to feel confident and sexy, and we don't. Like, do what feels sexy to you. Do you. And that might mean keeping clothes on. It might mean turning the lights off and putting senses and smells, or again, that mindfulness, that grounding in that visualization of, I am who I am, this spirit being, this being of mine, that's not changed. That it may be different looking, but it's not changed, I think is so important.
Well, we can still enter some messages while I wrap things up, if that's okay with everyone. First of all, thank you. Oh, here we go.
Sylvia, were you trying to ask something? Please feel free.
I think we're having some technical difficulties.
Yeah.
No worries. Go ahead.
No worries at all. We're not going to cut anyone off.
No.
Well, while we're doing that and waiting, I first of all want to thank you, Sage. You delivered big time, and I so appreciate. And as always, I learned something. I always do. I saw we have some local physicians who joined us, doctors who joined us. I was very appreciative to see that. Some had to go back, I saw, and return to their patient load as it was after their lunch break, but I was very delighted to see them in this presentation. I do want to remind, I'm looking for my notes quickly. I know I wrote it down somewhere. Here we go. I do want to remind everyone that we are here for you. That's what this is about. That's what today is about. There is so much help and so much care and so much heart here for all of you. We hope you come and take advantage of it here at Lucy Curci. We hope you join us. For those of you who are breast cancer survivors, breast cancer patients, however you want to label yourself, thrivers, we are here for you. Our group is open to you. We meet every Wednesday from 12 to 1. We are meeting in person. We are wearing masks, but we're meeting in person. You also have an option to call in. We have a phone set up, should that work better for you. Come and join us. Learn, grow, support, laugh. Sometimes we just talk about television, but we want you there. We want you to know it's a place that you're welcome to come and just be. And that's hugely important. The other is I would like to point out some upcoming events. The first is Wednesday, May 18th. May is Melanoma Awareness and Skin Cancer Awareness Month. And we are very fortunate to have Dr. Constantine Desano, one of our hematological oncologists, presenting for us on advanced stage melanoma, what many consider the deadliest form of skin cancer. There have been huge strides in the treatment of melanoma, and Dr. Desano is right at the forefront in leading clinical trials and treatment for these patients, and we're very excited to have him joining us. Everything is on Zoom. Our groups are in person. Our presentations to date are via Zoom. And you can go to Eisenhower Health, one word, eisenhowerhealth.org/calendar, and feel free to join us for that presentation on Wednesday, May 18th. I'd also like to point out that June is Survivorship Month in the United States, and we will be recognizing that by presenting every week a different program that we offer our cancer thrivers. The first week, we're going to be talking about nutrition and exercise and what's the importance. Why? Why are we always pushing that? It can be annoying, right? No, actually, it can be life-changing. And we want you to hear why from our experts. So please join us for that. Following that week, we are bringing our members of our, what we like to call our stress management and relaxation program. We have 2 experts who offer our classes on a regular basis. And again, will be speaking to us about mindfulness meditation. What does that mean? What do you mean? I've spent my whole life being told, use your mind, pay attention, produce. Now you're telling me to be mindless. Well, okay, how am I mindless? And what does that mean? But it really isn't. It's mindfulness and how to use your mind. And the other presenter at the same time, everybody's doing this together, will be our incredible social worker who focuses on the healing properties of sound, using Tibetan healing bowls and other forms of vibration and sound, and how you use that to center yourself and be calm in what can be an extremely stressful world, exacerbated when we're not feeling well. Lastly, at the end of the month, we will be presenting on oncology, social work, and counseling. What is it? Why do I need it? What do you do? So please join us, eisenhowerhealth.org/calendar. We are always honored at Eisenhower Lucy Curci Cancer Center to partner with Shay's Warriors and Shay Moraga, our yoga instructor, our guru, our person of all things thriving. It's so good to see you, Shay, and thank you for joining us. Dr. Sage Bolte, as I said, you always deliver. You never disappoint. Thank you so very, very much for chock full. Y'all, if you didn't notice, there was not one note. Sage wasn't looking down once. She wasn't reading a thing. So thank you for that depth and breadth of information that is helpful and meaningful and useful. So to both of you, our big thanks, and we look forward to more in the future. Be well, and thank you again. Thank you all.